Choosing the right orthopedic surgeon is a very personal and private decision. And like any other relationship, this is a very, very close bond that orthopedists should have with their patients. Part of my success is selecting the patient, talking to them about what they should expect out of their surgery, and tell them what is a good result. Many people think that if they get their knee replacement, it'll be exactly like a normal knee. Well, it's really not. It's made of metal and plastic. It has its limitations. But most patients can walk without pain, can sleep at night, can play some light recreational activities such as golf. That's an enormous improvement in somebody's quality of life, if in fact they want to do those things. A patient that comes in and they say, I want to play tennis, I'm a competitive tennis player, I like to play basketball, joint replacement is not going to be in their best interest. I think one of the most important things that I do is to explain to the patient the procedure in detail and what all the options are. I'm a surgeon. I love to do orthopedic surgery. I love to replace joints, and I love to see people up walking and 2 days later leaving the hospital with a smile on their face, knowing that they got good service and their life is just going to improve. But that may not be necessary for them. Maybe all that they needed was an anti-inflammatory. Maybe they needed an injection. A lubricant that we inject into the knees might be all that they really need to accomplish the things that they really want to do on a daily basis. One of the most important factors to successful surgery, and I think the most important factor, is a patient that is mentally ready for the challenge. Many times patients might be physically there, but they're not mentally ready for the hard work. Perhaps they have some other issues pending, perhaps work issues, stress issues. Those are important factors that I need to take into account before we talk about surgery. The surgery might be necessary, but you might not be mentally ready for the operation and the hardship that might come after that, the hard work of physical therapy, the pain that's involved, the time out of work. These are all legitimate things that if we don't sit down and talk about specifically, we could make a mistake and do the surgery at the wrong time. And at this point, it's the timing of the operation, and doing it correctly is also quite important. Finding the best solution for you starts with a conversation. Palmetto Bone and Joint can help.